Hello everyone, in this video we'll be showing you how to insert the Foley's catheter. So this is an OSCE station. So first of all we will take verbal consent from the patient and then ask the patient to lie down in supine position. Here we will not ask the female to evacuate her bladder, very important, because when we put the Foley's catheter we need to show that urine is coming or not, to be sure that we have put the catheter into the urethra. Then what happens? Patient lies down with the legs flexed and legs apart. Now first of all, if there is pubic hair, then we'll do clipping of the pubic hair, wear sterile gloves and then come towards the patient. Then cleaning of the external genitalia will be done. So with the help of a sponge holding forceps, we will take gauze pieces and dip it in betadine or povidone iodine solution and clean the labia majora and labia minora from anterior to posterior. So from forward to backwards. Never clean from backward to forward, because then you will bring infection from the anal opening. So cleaning will be done from the mons pubis anteriorly towards up to the anal opening and then through it, because after cleaning towards the back you will not come in front. So we have cleaned the labia majora and labia minora from anterior to posterior. Then what we'll do is, with the help of our left hand, we will retract the labia majora and labia minora. Once we have retracted the labia majora and labia minora, we get to see the urethra properly. So take one more gauze piece, you can take it with your right hand and then gently clean the region of the urethra and then through it. So I have cleaned the region of the urethra so that there is no infection going in. Now what will happen, I will take a little bit of lignocaine jelly, okay, which is 2% lignocaine jelly. I can take in my left hand and then I will take the Foley's catheter. Now my assistant will give the Foley's catheter such that he or she will withdraw the top part of the plastic and I will not touch this part of the Foley's catheter. The length of the female urethra is 3 centimeters. So my Foley's catheter will go inside by at least 4 to 5 centimeters. So the top 4 to 5 centimeters I will not touch. Otherwise I will introduce infection into the urinary bladder and urethra. So I have taken this, and tip of the Foley's where there is the eye or the drainage, where there is drainage of the urine, that part I will just touch the lignocaine jelly so that it gets lubricated, and then when I have already seen the urethral opening, I will directly put the catheter into the urethral opening. It is very important that I do not touch the near about areas, because if I hit and try and I blindly try to go inside, then I will touch the near about areas and I will introduce infection into the Foley's catheter. So this is very important that you directly insert into the urethra. Once I have inserted this much into the urethra, that is beyond this opening, this plastic, that means 4 to 5 centimeter has gone, I will stabilize it over here, and then my assistant I will ask to tear off this part of the plastic. So this posterior part of the plastic will be torn off, and now this is open. So what I will do is, with a 10 cc syringe filled with normal saline, I will push it into this bulb, and so when I push 10 cc syringe, this part of the catheter, that is the balloon, will get inflated and it will remain inside the urinary bladder, and with the other drainage port I will connect the urobag. At this time a flow of urine will come because the patient has not evacuated her bladder. But if in case the flow of urine does not come by any chance, which is rare, then first of all the most common chance will be that you have not inserted into the urethra and you have mistakenly gone into the uterus or vagina. In that case you have to take out, discard the catheter and again go for catheterization again. But if you are very sure that it is in the urethra, then wait for 5 to 10 minutes. By that time the patient will have 1 or 2 drops of urine coming out. If it is not coming out, then you have to remove and recatheterize the patient. So this is how we go for Foley's catheter insertion. Thank you.